So from that early stage of just starting your period, starting your cycle, I think we need to be empowered to know what happens in your body in terms of your hormones. When is there a drop? When is there an increase? What does this hormone do? And that can, have a domino effect into how you navigate, I believe, maternal mental health. And so we tend to just leave it at when someone becomes pregnant, but I think it definitely starts so much earlier. And it also starts with believing in women, because then we can be empowered, we can know everything going on in our bodies. But then a huge part of my work is believe us. If I tell you I'm going through this, believe women. And we need to break those barriers culturally, in terms of religion, just a lot of the unique barriers we have in Africa that we have a long way to go. We've come a long way because we are clearly having this conversation, but I think we still have so much work to do, because I do believe that menstrual health, endometriosis awareness, all of these things are mental health prevention, suicide prevention, I will even say, because then we get to understand PMDD, we get to understand what is not normal. And while it may be common, it's not okay to just push through and continue. So having the courage, the space, which I think a lot of women don't have, to voice out that this is what I'm going through, especially in those moments where women give birth and then they don't have support around the clock. You find that some go for their 2-week checkup, everything according to maybe the chart or script, they're fine, and then they go about their way. 6 weeks later, we're not checking 6 months and a year, 2 years. And if I'm not mistaken, again, I'm not a doctor, but just being on the ground in women's experiences, that is the places that they lack support. And in the hidden, quiet times when partner has gone to work, or when they have to get up and go back to work themselves because there's no sufficient job security, and so there's the letting go of the baby and the moving on. And then even with loss of babies, there isn't enough space for you. You kind of have to just keep going because you're a woman. We're still having to unlearn those things. And I will say early education is a big thing that I truly believe is a huge step in screening, early recognition, and that means early intervention. We can do something about it.